It is disruptive when you put new technology in somewhere, and if the users aren't ready for it, certainly in my trust where we're community-based, very much paper-based at the moment, putting in something electronic is, you know, worlds apart from what they're used to, so it can be disruptive. But as long as we focus on the benefits and we can report back on that the benefits have happened and they've actually occurred, I think we're ready for it. We need it, but yet it can be challenging. So I would really like to see a more standard approach to patient portals. So within my own area, we've just purchased a patient portal which we're going to roll out, but I know that there are other providers in the same geographical area who are also looking at portal technology, and I feel that it would be a shame if we offered patients more than one way of accessing their care record, their NHS care record. So whilst they'd be free to download whatever health portals they want to manage their own conditions, the one that contains their NHS health data I think should be consistent across the patch. So we're not asking a diabetic to use one system and somebody with COPD to use another. We should have a kind of standard. And I think that could be driven nationally, and that would be beneficial. So the use of patient portals, but the standardisation of them, I think, will be something I'd like to see. Not yet. I think the different technologies leapfrog each other. So the actual hardware platform, good battery, good connectivity, usability is better than it's been. The software applications that would drive mobile working are lagging behind. At some point they will leapfrog the hardware technology, and I think it'll happen like that for a while, until at one point we've got both the hardware, the network connectivity and the software working as they should as one. At the moment it's not quite there. So no, I don't think it's where it needs to be, but I think we're close. So we've introduced in our trust an assessment centre. So for new clinicians coming into the organisation, their IT skills are now assessed. They weren't before. Now that isn't to say that they won't get the job if they can't use IT, because obviously there's a shortage of good nursing and we wouldn't want to turn people away just because they can't use a computer. But what we are saying is if you don't pass that assessment, we will put on a range of training courses so that you can become confident and competent in the use of IT. And I think that's really helpful. There is always a challenge in healthcare because we've got the provider competition between NHS organisations that can be challenging, and not everybody wants to share. So if we've got a safe place where people can share their ideas without worrying about giving the crown jewels away to the competition, I think that's a good place to be. So having that hub of good sharing is helpful.